Good afternoon. My name is Sherry Young, and I will be providing education on systemic lupus erythematosus in the 12 to 18-year-old adolescent. SLE, or systemic lupus erythematosus, is a chronic and autoimmune inflammatory disease that affects connective tissue in multiple body systems. It commonly affects joints, skin, kidneys, heart, and lungs in the adolescents. It also primarily affects African American females. Adolescents have the highest disease activity for lupus. This disrupts physical, psychological, and social well-being. It is usually diagnosed just post-puberty. This presentation on lupus will highlight pathophysiological changes, treatment plan, modifiable and non-modifiable factors, and then primary, secondary, and tertiary interventions. The musculoskeletal system is primarily affected by arthritis with lupus. This is often present at diagnosis, and it occurs in 53 to 95% of patients. Polyarthritis in the knees and wrists are commonly affected. It also causes bone mineral density changes in juvenile lupus. This can be from the disease, from another disease, or from medications. It can also be from the steroids, decreased physical activity, or puberty and growth delay in these patients. Treatments include corticosteroids, pain medications, and then monitoring the physical, psychological, and social well-being. The hematopoietic system is affected by anemia, and anemia results from chronic inflammation and suppressed erythropoiesis. Aplastic anemia often occurs, and that's when the bone marrow does not produce enough blood cells. An acquired type of bleeding or clotting disorder known as von Willebrand's disease can occur, along with thrombocytopenia, leukopenia, and antiphospholipid syndrome. Treatment, really, anemia of chronic inflammation does not require a specific treatment unless the patient is symptomatic or renal insufficiency is present. One can also increase dietary iron. The cardiovascular system is affected very significantly. The heart and blood vessels are damaged by chronic inflammation. Vasospasm of the fingers and toes, known as Raynaud's phenomenon, can occur. Ischemia can result from occlusion of the vessel. The patient is at high risk for peripheral vascular disease and atherosclerosis. Endocarditis is the very first manifestation of lupus in adolescents. Secondary dyslipidemia is present in most children, and this is very significant for these patients. Treatment include corticosteroids, efforts to reduce obesity, hypertension, and premature atherosclerosis, and avoiding cold conditions with Raynaud's phenomena. This diagram illustrates the pathophysiology of dyslipidemia in lupus patients, and you can see the multiple risk factors with dyslipidemia. The respiratory system is also affected significantly. And there's inflammation that leads to pleurisy, pleural effusions, alveolar hemorrhage, pulmonary embolism, pulmonary arterial hypertension, pneumonitis, chronic interstitial lung disease, and shrinking lung syndrome. Interstitial fibrosis is a change that is specific to lupus. Symptoms include dyspnea, chest pain, which rapidly progresses, fever, cough, hemoptysis. There are two types of lung disease that occur. That's acute lupus pneumonitis and chronic interstitial pneumonitis with interstitial fibrosis. Treatments, corticosteroids, nonsteroidal anti-inflammatories, antimalarials, immunosuppressants, pain medications, plasmapheresis is used. Another goal is to control the cardiac effects, such as cardiomyopathy and myocarditis or hypertension, because these can lead to heart failure, ultimately leading to pulmonary congestion. CAT scans and chest x-rays and pulmonary function testing is helpful to monitor the respiratory system. Renal and the urinary system. So the kidneys are affected very significantly as well. There's lupus nephritis, which occurs in 70% of all children with lupus. It is more severe in children with lupus. This leads to hypertension, weight loss, and loss of appetite. It affects boys and girls equally. There's also inflammatory disorders, which lead to edema and inflammation. Glomerulonephritis occurs. That is the leading cause of chronic kidney disease in the United States. Nephrotic syndrome can also be very severe. You may notice periorbital edema, which is a very early symptom. Pitting edema, which is found in 95% of children with lupus. And then protein and lipids leak into the urine, leading to hypoalbuminemia and anasarca. The diagram on the right shows Caucasian and African American children, and it's just highlighting that the African American children with end-stage renal disease have a higher mortality rate over the Caucasian children with lupus and end-stage renal disease. Treatment includes monitoring the kidney function, corticosteroids and immunosuppressants, eating well, monitoring the fluid status, and along with the psychological effects, and then ensuring treatment and proper follow-up. Fluid and electrolytes. So the renal changes obviously cause the imbalances with the fluid and electrolytes. There can be a fluid overload, there can be a fluid deficit, or there can be edema. The immunoglobulins are excreted in the urine, which increase infection risk. And then the protein loss in the urine causes the liver to increase albumin, triglycerides, and cholesterol, which increase the child's atherosclerosis risk. Treatment, monitoring the labs, the fluid status, and then adding in the corticosteroids. The reproductive system, of course, the adolescent is either going through or getting ready to go through, or have gone through puberty. The female hormones, estrogen and progesterone, and then the male testosterone hormones. It's important to remember that lupus does not impair the adolescent from becoming pregnant, and if the child should become pregnant, they would be of high risk due to the level of disease activity in this age group. SLE changes, there's a delay or it can alter puberty. It can cause infection in females who use IUDs. And treatment would be to assess the psychological well-being, and then, of course, of great importance would be reproductive health education and birth control if needed. Endocrine system. The endocrine system is affected, and it also affects multiple other systems. So we have inflammation, it produces cytokines, it activates the HPA axis, the hypothalamus, pituitary, and autonomic nervous system. Stimulates hepcidin release from the liver, anemia. It also causes hypofunctioning of the reproductive, cardiovascular, and CNS systems. Same treatment, corticosteroids, and a healthy lifestyle. The GI system is not routinely affected, and it's also hard to tell which symptoms are truly lupus changes, or if they're from other medications or other diseases, or if they're even side effects to the current medications. Malnutrition and malabsorption can occur from the edema of the intestinal mucosa, leading to diarrhea, anorexia, poor absorption, and protein loss. Also, protein-losing enteropathy and inflammatory bowel disease, acute pancreatitis, and intestinal pseudoobstruction can occur. And there's a food pyramid just to show what a healthy diet would be for this age group. Treatment, pretty similar to what we've already talked about: glucocorticosteroids, the non-steroid anti-inflammatories, pain management, monitoring the psychological, physical, and social well-being of the child. Reviewing the care plan. So we have the patient, they have to be compliant, they have to have a healthy lifestyle, they have to abstain from high-risk behaviors which are common in adolescence: drugs, sex, and drinking, smoking. A psychologist needs to be involved for managing and coping with chronic illness and managing the side effects of the drugs. The medical providers are responsible for the labs, monitoring the disease activity, evaluating their physical, psychological, and social well-being, education, tons of education. They need to know the severity of the disease, medication, A case manager can be involved if cost is an issue with the medications. Psychologists can be involved for coping and support. They need education on exacerbation prevention, pregnancy prevention. The medical providers provide pain management, and then of course close follow-up. The family is crucial in maintaining compliance with transportation and medical follow-up, disease management, the medication importance, prevention of exacerbations, side effect management, and of course the psychologist can be as equally important to the family for support as the patient. The 3 different levels of treatments, the primary, secondary, and tertiary. So the pediatrician is the primary care, monitoring the well-being, treating any immediate needs, identifying the needs, ordering labs and referrals. Secondary care would be the specialist, the rheumatologist, nephrologist, cardiologist, and such. It's definitely a very complex team of physicians that follow these patients because there's so many systems involved. And then for tertiary care, it's usually testing at a specialty center or hospital, biopsies, monitoring the disease activity in the Lupus disease activity index, PFTs, EKG, CTs, or any other further testing. The risk factors, modifiable and non-modifiable. Of course, the modifiable, diet and exercise, compliance, hypertension, lots of things that we can change in these patients or monitor, and statins for prevention with the dyslipidemia, non-modifiable factors, ethnicity, race, age, the medication side effects. There's not a lot of treatment options, and they do have significant side effects, unfortunately. The high mortality rate, the disease activity in this age group, and then puberty on top of these other things. Conclusion: lupus is a chronic inflammation. It causes chronic inflammation and it affects multi-systems and multi-organs. The medication compliance and follow-up is crucial. Adolescent physical, psychological, and social well-being must be assessed. Multidisciplinary care is necessary, and medical care must be prompt, and education is just critical, that it's given and that it's understood. This was the care map. The care map described the African American in the severe risk for disease, and then the psychological disturbances with that, along with the age of growth and development and puberty, and then risk-taking behaviors. You put those two together in the middle to describe the African American risks, and then the bottom box puts the scope of the disease together with the severe disease, the psychological disturbances, and then you add in the growth, puberty, and the risk-taking behaviors. So that's how I put together the care map. Here's my references. Thank you so much.